Welcome to Impact by DIFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hey everyone, thanks for tuning into this episode of Impact. I'm your host, Shane Allen. It's March, and if you didn't know it, March is Mental Health Awareness Month. And I thought we could take this time to talk about mental health and specifically how it relates to those living with HIV and AIDS. And I think I have the perfect person for that. Joining us today is Jessica Halem. And Jessica, I'm going to read a little bit of your accolades real quick.
Oh, we got some shtick humor here. I like it.
I'm going to shorten this, though. For those of you who are listening on the podcast, there's a scroll of paper below me. So Jessica Halem, an award-winning expert in LGBTQ and health equity. You're the you recently spent 6 years as the first ever LGBTQ director at Harvard Medical School. A role which is still very unheard of in any medical setting. Earlier in her career, Jessica ran the Lesbian Community Cancer Project in Chicago, where she implemented the nation's first cultural competency trainings for the CDC. And she also served on then-candidate Obama's first LGBT Advisory Committee. She also serves on the board of the Tegan and Sarah Foundation. No big deal. Ladies and gentlemen, again, Jessica Halem. So
Wonderful.
I'm so glad that you could join us.
Yes.
I really appreciate it. By the way, Jessica also works with Included Health, which is another great organization. And let's talk about this. So it's Mental Health Awareness Month. We always talk about stigma surrounding talking about HIV and AIDS, but there's another type of stigma as it relates generally to mental health, right?
That's absolutely true. I mean, that's the perfect way to start this conversation, is to get serious about this topic of stigma. And I think, we can say it, and I think I just really want us all to take a minute to really think about it. There's two sides of a coin. On one side is shame, and on the other side is stigma. So stigma is the external forces, the way I think of it, the external factors, right, that try to shame us, either because of who we are, who we love, what kind of sex we have, what our life, right? And then that becomes stigma, the internalization of that external shame. So stigma is really that, thinking about that shame and stigma, the external and internal, the way they work together, and how to really put up a wall, right? How to really stop it before we really internalize this.
How important is mental health to anyone living with HIV and AIDS?
It's everything, right? The mental health portion of being someone living with HIV is, the part that I like to say is we've got incredible medication. We've made incredible breakthroughs. We've got incredible doctors and providers who are ready to take care of your physical self, and that it's our job, right, to be the person to integrate all of that, right? So are you ready to receive? Are you ready to really take advantage of all of the expertise that's out there to help you physically stay and be well? And it's there, right? We know that you can stay well. We know that you can be well with HIV, but can you really do the extra work, right, that the medications can't necessarily fix for you? You've got to do that work to really bring all of yourself to this life, right? To all of this. So of course we talk about going to talk to therapists, being in therapy, talking about medications to work with your anxiety and depression. But most importantly, are you ready to be worth it? Are you ready to put yourself first? Are you ready to be somebody who's taking care of themselves, mind, body, and soul? Right? And so that's the part that I love about talking about mental health in the HIV community, because the drugs are there, right? I've been doing this before the drugs were there. And now we've got the drugs, we've got the care, we've got the doctors in place, and now I need everybody to get themselves ready.
Yeah, and I'm very blessed in this line of work with DIFA to be able to talk with a lot of people and hear their stories. And there's one story that really stands out to me was an African American woman I was speaking to, and she said that when she received her HIV diagnosis, she felt like she was no longer worthy of anything.
Oh, right. The
How does?
number.
Oh, go ahead.
No, you just named it. I mean, we have to remind ourselves that we are worthy, because she didn't start off like that. That's what the world convinced her. That's external forces. Every baby is born on this planet loving themselves, right? Think about a baby, how a baby will stick their foot in their mouth. They want to eat their own toes. They love their foot so much. They're so in love with their body and what it can do, and it makes them laugh. Right? And then somewhere along the way, the world convinces us that we are not worthy, that we are not worthy of love, that we are not worthy of respect, that we are not worthy of life. And so we've got to get back to that original place where we were, of course, completely worthy, completely loved ourselves.
You know, you talked about being involved in this type of work before we even had antiretroviral therapies and things like that. I'm only 36 years old. I was born in 1984. I'm very I don't know if I'm aware, I should say, that I did not live through the height of the AIDS crisis. A lot of my friends are older than me. A lot of my friends did live through the height of the AIDS crisis. I hear these stories about, you know, burying a friend a week before we got it under control. That's trauma. And a lot of people, especially gay men, because that's, you know, unfortunately, AIDS affected the gay community first. A lot of gay men are living through that trauma. Talk a little bit about that and how we need to talk about that more. I feel like everyone wants to kind of think about it as the past and move on.
Right.
But don't we have to deal with that a little bit?
Well, you really are, you're really naming all of the pieces that we have to center in our lives as a community, the HIV community, LGBTQ health community, a sexual liberation community. HIV is a disease that gets us where we are our most happy, right? It gets us around sex. And what a whammy that is for a disease, for an issue for women and for men, trans people, gay people. That trauma is inherited, whether you experienced it or not. It is passed down to you. It is the air we breathe as an LGBTQ community. That trauma is around us at all times. Whether you experienced it or not, it is in our DNA now. We know that trauma, you know, they've studied trauma from Holocaust, Jewish Holocaust survivors, and they can show the DNA is affected 3 generations away from the initial site of the trauma, right? So my grandparents, my great-grandparents could have been affected by the Jewish Holocaust, and that's passed down in my DNA to me. We think about if you, anyone watching this who comes from a family of alcoholics, we talk about how alcoholism is a disease that affects generations within a family. I might not be an alcoholic. I might not have even lived with the alcoholic, but it affected the experience of those around me. It's so important for gay men to talk about living in the aftermath, living in a space of great joy and pride and trauma on the other side of it. And of course, that's, again, these 2 sides of the same coin is something we talk a lot about in LGBTQ health, right? So here you are on one side, we're in the age of pride parades and growing acceptance. And many of us are living very joy-filled lives, right? And then at the same time, how to really balance this hard part of living with HIV, living with the history of those with HIV, living with who we've lost. Do we live for them? How do we do this work remembering who we've lost? How do we take advantage of the medications and the incredible medicine that's around to keep us alive and keep us safe? How do we live that? Take full advantage of the life that we have the ability to live now. And that comes from really honoring, again, how do I balance both of them all at the same time? I've got a lot of joy in my life and pride. I'm smiling on the outside. I'm naked on the float during the Pride Parade. And then I might also be somebody who has a story of childhood trauma, who's the survivor of family or religious persecution and stigma and shame, right? And I'm both people at all times. And that's something unique to being gay. And that's something unique to being gay.
Well, and I've had the pleasure of meeting you before this discussion, and I came into this without any notes because I knew this was going to be such a great discussion. And something, as you were talking, that just hit me. We now have this recently created trauma, this intersectionality among people of color, specifically women of color, who are disproportionately affected by HIV and AIDS. They've already had to deal with being a person of color and the trauma inherently associated with that in America. And now this new trauma of again, I go back to that conversation with that woman about I'm not worthy enough. And now that's just adding to this weight that people carry around, which speaks to the importance of talking about this, just getting it out in the open and not being ashamed of talking about mental health and everything that affects you. And to say things like, I have a psychologist. I see a psychologist every week, every other week, sometimes every week. And that's okay. That's totally okay. Oh you should too.
It takes a village to keep this all together. What I like to say, it's like, I didn't come out like, this doesn't happen just when I wake up in the morning. I've got mental health professionals. I've got friends and family. I've got thinking about the food I put in my body, how I take care of myself physically. It takes a lot to be this fabulous. It's a team effort.
I love it.
When I think about the woman that you shared about how it felt after getting that diagnosis, I was reminded of a wonderful oncologist that I know who spends all day long with folks who receive a cancer diagnosis. And he used to tell me that he wasn't in the cancer business, he was in the forgiveness business. And that his number one job was, it did not matter who you were, where you came from. When he would help someone, he would tell someone their cancer diagnosis, and immediately they had so much regret, so much shame, and that his job was to help them work on forgiving themselves, right? And so that's the same thing with HIV. Any major diagnosis, right? Anytime we receive a diagnosis that someone has convinced us is our fault, right? It's so hard to not fall into that trap. And that's why we have to work on really understanding how we move in the world, and our choices are really influenced by so much, what we have access to, what happens to us, and that we are always in control and in power, even when things happen to us that we might not have planned, right? And so how to have that forgiveness so that we can live our life and not start dying.
And the great news as well, DIFA supports a lot of organizations who are trying to work themselves out of a job, right? These days, a diagnosis of HIV is no longer a death sentence. You're going to die with it, not from it. And organizations like DIFA, so we have this unique, we're in this unique position to be able to see so many points of view with all the organizations that we support. And I can tell you, there's light at the end of the tunnel. There's this thing's going away, and in our lifetime. Which is great.
What's so exciting about being a part of the HIV fight and organizations like DIFA and the support that they give is that everything we're learning about HIV is going, it's just been so exciting to watch. And that all of that great innovation and breakthrough, we're actually going to be able to use in other diseases and other health issues as well, right? It's so exciting to support something that had such stigma and shame to it, and then to think, and now we're going to help everyone, right? It's what we're seeing now around the vaccine, the process that we went through to get the COVID vaccine so quickly and well, such a team effort. It was public, and people sharing what they learned. There's so much that we're all going to benefit from, and the same thing with HIV. It's exciting to learn. What we know about, again, thinking about stigma. That's another episode of schmegma, the schmegma problem and AIDS. There is a schmegma.
This is why I invited you on.
Get your vaccine, people. That's next. Gays are ready for summer. Listen, some of the data, well, just while I'm talking about the vaccine, some of the data is of early vaccination is showing that LGBTQ community is some of the first and heavily vaccinated. They're really getting vaccinated, right? And I was talking to a bunch of other folks about this, and I was like, gay people are ready for summer.
There's a beach with our name on it. And now, if only we can get that same mentality. Maybe you're not wanting to get to a beach or to a party, but we need to get that mentality rolling to other communities, people of color and Hispanic communities and things like that. We really need to make sure that, the Asian community, we need to make sure that everyone has that mindset. What I don't care what your reasoning is, what your goal is for getting vaccinated, but get it. They're giving them away like candy.
They're giving it away.
Go find one and get it.
Listen, if getting laid is the reason that you go get vaccinated, go get it. Go get it. Listen, I just love this idea, thinking about what we learned. Again, one of the things that's coming out of how easy we're making it to get a vaccine now is something, well, what if we started doing that for PrEP? What if we made it that easy to get PrEP? What if I could go to any CVS or Walgreens and go get PrEP? Go get birth control, right? What if we made it that easy for trans people to get hormones? What are we learning about this moment that we could use in the HIV community to get PrEP out there into hard to reach communities? We know people don't necessarily have a primary care provider. We know doctors aren't trained in PrEP, but boy, PrEP is exciting, and I want to just put it in the water in Puerto Vallarta.
Well, and that's the other. And let's loop back around real quick to included health.
Yeah.
If you are uncomfortable talking to your doctor about PrEP, find one that you could talk to about. Find an organization like Included Health that can point you in the right direction. Whether or not you're, because PrEP is for men who sleep with men, or men assigned at birth who sleep with men, and so whether or not you are, I'm sorry.
We're testing it now in for other groups as well. Yeah.
Perfect. But my point is, especially if you're bisexual, perhaps you're on the DL, whatever your story is, find a doctor that you're comfortable talking to about this and who knows about PrEP, because PrEP was and is a game changer.
God, I feel like I wish that with the second dose of the COVID vaccine, they were giving out PrEP, because I just feel like I'm just so excited about PrEP. There's just so much momentum around it. We've got, it's happening more and more. But again, I want to go back to this point you were making about Included Health. One of our barriers right now is that current doctors and providers are not trained in PrEP. They don't know what it is. And we don't have enough doctors who know what it is. So you've got the double whammy. They might not know about it. You might not feel comfortable bringing it up. You've got to find a provider that understands it. You feel safe to talk about it. We want to find ways that it could happen online easily, but but Included Health and maybe your local LGBT community center. We just want to get it in you. We want you to have fun. I just love it. It's, again, it doesn't matter how you identify. HIV is a disease that doesn't care if you use words like bisexual or gay or trans to identify. It just is a disease, right? It's a disease that happens, and we just need to get it. You know what I mean? It's just like, let's get safe. It's like birth control, people, right? We want to control, we want to be able to have fun.
Mm-hmm.
Want to be able to have fun.
Yeah, exactly. Jessica Halem, thank you so much. It was such a pleasure having you on the Impact Podcast. I really appreciate you taking the time with us today.
Well, I love this. Thank you, Diff. I'm a big fan. Keep up the great work. And just listen, any step we're making to have this conversation on shame and stigma, I love it. Keep up the great work.
Love it. Thank you so much. You can learn more about DIFA Dallas online at diffadallas.org. Thanks, everyone.